Okay. Good afternoon and welcome to everyone joining us. Fair for All is a nonpartisan organization with the mission of safeguarding civil liberties. I am Dr. Nikki Johnson, the co-director of FAIR in Medicine. My guests today are concerned about the negative impact of disseminating inaccurate health and scientific information on our health here and abroad. They will share their thoughts about major contributors to American distrust of government, health agencies and systems, and major contributors to American distrust of our and media. Sorry. We will discuss, though, today specifically how the Trump administration pledges to rectify public distrust in the scientists and the health policy arena, and whether this will be an effective approach or more of the same bad medicine as we very, very closely approach the vote on the nomination of Bobby Kennedy to Secretary of Health and Human Services. We'll be having this discussion. So please welcome Mr. Cameron English. He's the Director of Biosciences at the American Council on Science and Health, and he is a co-host of the Facts and Fallacies podcast. Before joining the American Council of Science and Health, he was managing editor of the Genetic Literacy Project. He has written for Forbes, Big Think, and Real Clear Science, and he's also appeared on the Dr. Phil Show. Dr. Liza Lockwood, who has been here with us before, most recently, we were talking about preservatives and pesticides in foods. She's an emergency medicine physician and medical toxicologist with a longstanding interest in humanitarian and tropical medicine. Dr. Lockwood graduated with honors from the Royal College of Surgeons in Ireland and completed her residency, including a year as chief resident in the Department of Emergency Medicine at Washington University in St. Louis. After finishing her toxicology fellowship at New York University in 2006, Dr. Lockwood returned to Washington University and started an accredited fellowship in medical toxicology, after which she became increasingly involved with humanitarian relief projects. Dr. Lockwood is now the medical affairs lead for the crop science division of Bayer and is a passionate advocate for the role of modern agriculture in maintaining food security, alleviating poverty, and improving public health. Dr. Lockwood is a co-host of the Facts and Fallacies podcast that is sponsored by the Genetic Literacy Project. She can be found on X as Dr. Liza, MD. Jon Entine is the founder and executive director of the Genetic Literacy Project. He is a lifelong journalist, TV news producer, and executive. He's an author, a think tank scholar, sustainability and leadership expert, commentator, and public speaker on media, religion, ethics, sports, and genetics and science policy, focusing on disruptive technologies, including energy, chemicals, and the biotechnology revolution in agriculture and biomedicine. Jon is also known for his investigative journalism in TV and in print. Welcome to my panelists.
Thanks for having us.
Thank you.
Thank you. All right, thank you guys for being here. We were having a lively discussion in the green room, so I hope we can continue some of that for our audience tuning in today. So let's just start off here. Let's just start off with the kind of the what do you think are the main contributors to public distrust? Our intro to this webinar, at least on X and on the Zoom registration link, I included some statistics. A 2024 Gallup poll and also recent Pew Research Surveys show that just 22% of US adults trust the federal government. Only 1/3 trust the US health system. And approximately about 50%, but no more than 50%, trust the American media. So what do you guys think is the major contributor, or are the main contributors to public distrust of health and science information? And I'll start with Dr. Liza, since you're on my screen left.
Okay, sounds good. I think that's a complex question, and I think it's multifactorial. I think this distrust is bipartisan. I think it comes from both sides. It's not a right or left issue. I think it really, there have been threads that have been going on, I think, increasing distrust over the past probably decade. But I think COVID put all of this into relief and really polarized the population. I think that physicians and the public health establishment were largely well-intended with COVID in trying to protect the public from a truly devastating pandemic. But I think that the public health recommendations wound up overstepping some really important issues for Americans, and that led people to be even more polarized. So, for example, when people were talking about losing their businesses, that direct impact wasn't felt by public health officials and physicians because we didn't lose our jobs. We didn't lose our livelihoods.
We were essential workers.
We were essential workers. And so I think for people who had businesses that were billed as not being essential workers, all of a sudden their livelihoods were gone and they might have been in an incredible amount of debt and had no way to, finance their lives. For physicians, I think the situation now with all of the DOJ stuff is giving the public health establishment and the research medical establishment a little bit of a perspective on that position, because for the first time, they're feeling the impact of what happened to a whole swath of people in the general public. And it's a very important question. People sort of go, oh, we shouldn't, trade public health for economics, but it's not a be all end all. If you have no income, you can't pay for health. And so I think that this is the crux of the problem. And it has been now sort of the public health establishments is seeing what the impact was on the general public in the past, and I think that that's created a lot of division. And so it's important it's an important way to look at this holistically. I don't know, John, Cameron, what do you think?
Yeah. Before you guys chime in, I want to say the point that you made about DOJ is also exposing some of the things that we were told.
Yes, that's
during
exactly
the
right.
pandemic. Lots of things that people were very suspicious about, and has confirmed. Some of the things that we were told that were not true. And
that's exactly right.
Namely, the Wuhan lab leak theory. That's a huge one that has come out recently.
The Wuhan lab leak theory, the financial input to the Eco-Tox Alliance, whatever Eco-Tox Alliance, is that what they were called? I can't remember. But Eco Health Alliance is what it is. Okay. And I think that, there's a lot more transparency about where money was going. And I think people are wide-eyed about it.
Yeah. Yep.
So I'll jump in here. In one sense, I'll agree with Liza. In another sense, I'll take a different tactic in looking at this. The part I'll agree with is that COVID definitely has, is a stake in the ground of making us understand how broad the lack of consensus is on so many issues, and it also underscores the structural issues. The political issues that we've seen over the past few years, and also underscored how multifactorial this is. Here's where I'll disagree. I think these issues are not political as much as they are structural. And I think a lot of it has to do with, and it's been said a million times in other contexts, has to do with social media and the way we consume information. Before, we had a very narrow number of information channels. I was a producer at NBC News and ABC News at the network level for 20 years. We were the kings. I did a documentary with Tom Brokaw in 1989, believe it or not, on the genetics of Black athletes. It was very controversial, led to a best-selling book. It got 17 million viewers. Today, that would be better than, the only thing that would be higher rated than that would be the Super Bowl. Now, network TV gets 2 million viewers, 3 million. The role of the major media, whether it's the New York Times, Washington Post, even the Wall Street Journal, versus social media is just changed the landscape. So all kinds of information now has kind of equal weight in many people's minds just because it's accessible, and also because who's accessing it. Younger people, my daughter's 26 years old, never watch network television news, doesn't watch CNN, Fox, any of these things. Everything is through social media, and it's up to her to figure out how to gatekeep that. And some things she's good at it, and other things, like all of us, she doesn't have the technical sophistication to really understand between smart people saying stupid things and stupid people saying smart things. So that's one thing that's a real challenge. The other is I'm sorry.
Before you interview, I do want to point out the fact that we have learned that there was influence from our government on what information was allowed to be shared in the pandemic on social media, right? I'm talking, so that is a major.
Oh, no, I'm not denying any. Okay. I'm not denying any of this stuff. COVID. I'm just trying to set the bar way earlier than COVID.
Got it.
And what COVID did is bring it out into a stark light for all kinds of different reasons. But the other issue, which is rarely really talked about, is although this is all in an ideological context, with the idea that the ideologies are now siloed much more than before. But you look at environmental issues and you talk about so-called vaccine denialism, which I do think actually that is an issue on the conservative right a little bit right now in lots of very disturbing areas. But I wrote an article for a magazine called Quillette. You may or not be familiar with it. It's a very iconoclastic, not left, not right. It'll step on anyone's toes, Australia-based. And basically it says vaccine denialism is a left-wing creation, in the same way that Robert F. Kennedy Jr. is a left-wing creation. You go back to the early days of the 12-person study from back in 1999 that led to all the links with autism. It was all promoted by the Hollywood left and the liberal establishment, and their belief that corporations are exploiting the world so that they're we can't trust them, and does it cause autism? They don't care. All they want to do is make money. These are all left-wing memes that have dominated our discussions about science and health for so long. So it's not surprising in a social media COVID situation where the narrative just in some ways flips 180 degrees. You go back to 2019, guess which county in the United States had the lowest childhood vaccination rate in the United States? Well, it was Marin County, one of the most liberal counties in the United States, a collar county to San Francisco. 4 of the 5 counties in the United States that had the lowest vaccination rate were around San Francisco. The other one was the Hasidic Jews in Queens. And then you go to 2021, which county had the highest vaccination rate for COVID? Marin County. And all the arguments that they mustered against childhood vaccines, if they really believed in them, if they were science-based, would have applied to COVID. But in other words, it was never about science. There was a brilliant book written by someone, 2 people that Cameron and Liza and I both know, called Science Left Behind, which was for so many years, for decades, everyone was saying the right wing, science is our science denialists. And there's a strain of it, sure, but the left-wing science denialism has been there and steady all through these discussions. So I don't want to switch it and say now the right is right and the left is wrong, but let's just say here, these are issues that have gone on for a long, long time. So when you have something like COVID, it's like lighting a match on a pile of gasoline. It's going to explode.
And to add to that, really briefly, distrust in the COVID vaccine actually started on the left.
On the left.
There was there were videos of people saying Operation Warp Speed was too fast, and it's so. And then what was interesting, as soon as Biden administration came into office, they flipped and said, "Oh, well, we take that all back." And
specifically, Kamala Harris was out on the campaign trail in 2020 saying that no one should take Trump's vaccine.
That's exactly right. That's exactly right. So that this is a really amazing technology in the potential that it has to manage other diseases. For example, cancer. without chemotherapy. There are some really interesting trials out there. But because of the distrust that was established in this vaccine, people, I get worried that it's going to get thrown out like GMOs, baby with the bathwater kind of thing. And it's terrible because everybody got so set in their particular political view. They were either anti-Trump or anti-Biden. And because of that particular political view, they've let the science go by the wayside. And I find that difficult. That's really unfortunate.
And that's where I disagree with you, Jon, on saying that it's not political, because I absolutely think that it is. Oh, and I mean, honestly, when you brought up the whole county in California, I can't remember what it's called now, but I distinctly remember in medical school and residency blaming Jenny McCarthy for.
No, it's totally political. But what I'm saying, when I say it's not political, I'm saying that they're idiots on the left and the right.
Absolutely.
Shape it to fit their ideology. It's not like the left is smart and the right is dumb, or the other way around. It's really, you pull the threads of disinformation from the pile to support your point of view. And then you claim that you're the ones in the right and your opponents are the ones who are political. And we just have enough history to know that that's not true. Yeah. Well, I mean, it may not even necessarily be disinformation. It just may, we do select the things that confirm our biases. So that's part of it too. And some of it's disinformation, some of it's not disinformation. Some of these conspiracy theories turned out to actually be true, right? Realities. So that's one of the words that makes me cringe a little bit, because I don't want, because then we start to tell people that you're not telling the truth, or you're not thinking clearly, or you're not thinking critically, when you probably are, you might be, you just don't know. You haven't thought it through all the way. But Cameron, let's hear from you. What are your thoughts about where this is stemming from?
Sure. Well, I think Jon and Liza both gave great examples of what's going on, but I think, to just put it simply, the science community as it exists now functions to reinforce progressive political dogma. And there's many examples we could go to, but I want to quote from an article that Science published. This is one of the top 2 academic journals in the world. The article, and I can link to it if anyone wants to read it, it's called "Statements by Scientific Organizations Can and Should Influence Society." This is by an anthropologist at, I think, Princeton. But direct quote here: "Science as a field of practice and scientific organizations have never been neutral. When it comes to issues in human society that scientific knowledge and practice can inform upon, merely sitting on the sidelines pretending to be neutral," in quotes, "is also a political decision, one that often has detrimental effects on both science and society." So, given the current political climate, what that is saying is we are here to enforce, certain political causes, and the examples are myriad. The most outrageous ones to me, that we've talked about to death on our podcast and on our spaces, the CDC coming out with a breastfeeding guidance for non-binary people, effectively saying that men can breastfeed. Utter absurdity. If you expect the average American to look at that guidance from the most prominent public health agency in the world and go, "I'm definitely going to trust what you say about vaccines," because, right? You say something like that. During COVID, of course, we had these riots in the summer of 2020, all kinds of property damage, a lot of very serious injuries. Now that's a whole nother topic. But what's key here is that the media, with the backing of a lot of infectious disease experts, said, congregating during a global pandemic shouldn't discourage you, or excuse me, that this isn't a risk relative to the threat of white supremacy. So this is May and June 2020 when these statements were coming out from the science community. So there's no vaccines, there's no antivirals. Your kids can't go to school. Many people can't go to work. You can't go to church. You can't bury your mother who died. You can't even go surfing by yourself on a beach in Florida. You'll be arrested for that because there's this deadly virus circulating, don't you know? But if you want to go to this rally, which we approve of, don't let us stop you, right? It's these sorts of schizophrenic statements that people are looking at and they're going, how can I believe this? One other thing before I stop talking here, because I'll talk for 3 hours straight about this. We know without a doubt that the Biden administration was threatening Facebook and Twitter with legal consequences if they did not censor misinformation. And I put that in quotes because a lot of the content they wanted throttled, or the accounts they wanted pulled off the platforms, were telling the truth. And it's in these emails. It's in the Twitter files that Matt Taibbi released. It's in the discovery material in the Murthy v. Missouri lawsuit. You have Facebook, you have the World Health Organization, you have a lot of these government-funded NGOs, speaking of the USAID controversy, telling each other this information is correct. For example, there are rare side effects associated with the Johnson & Johnson vaccine. The New York Times reported that. But you had the administration telling the platforms, we want you to throttle this because we're afraid that people will misunderstand this. You also have messages where they say, we want you to take down content opposing vaccine mandates. And that's critical. Not vaccines. I think everyone on the panel loves vaccines. I have 2 young children. They receive all their shots. I love medicine. It's a lifesaver. But you have policy disputes now where science is being used as a cudgel, right? You would, as Jon was sort of saying just now, right? You disagree with me. You're the anti-science side. So if you're opposed to a vaccine mandate, and there's good research showing that those tend to backfire. But my point here is they're using the mantle of science to bash their political opponents. So just to wrap up, this is one of the reasons why so many people look at the CDC or the FDA or whichever institution and they go, I just don't believe you because this is all absurd.
Yeah, awesome, awesome, great answer, and it's actually a great segue into where we are now. So we have a new administration, and some new policies and some new nominees. RFK Jr. is the new nominee for as Secretary of Health and Human Services, and his confirmation vote at least should be coming up. I'm not sure if it's going to happen today or not. I believe that it's supposed to be, or scheduled to be. Let's talk about his vision for health and human services and what we think that means for sort of fixing this issue. How do we think that it's going to either improve or keep the status quo the same or go too far to the other extreme? Or I just want to hear what you guys think about that. So let me read an excerpt from his opening statement in his Senate Finance Committee confirmation hearing. And just he writes, today Americans' overall health is a grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than in 1960. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, asthma, Alzheimer's, ADHD, depression, addiction, and a host of other physical and mental conditions are on the rise. The United States has worse health than any other developed nation, yet we spend far more on healthcare, at least double in some cases, triple. Last year, we spent $4.8 trillion, not counting indirect costs like missed work. That's almost a fifth of our gross domestic product. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with other countries that pay a third what we do, yet have healthier workforces. So this is his description about, the American health, American health and American healthcare. And his prescription is to say that there's no single culprit for chronic disease. Much as I've criticized certain industries and agencies, President Trump and I know that most of their scientists and experts genuinely care about Americans' health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal to pledge to make some Americans healthy again. Thoughts?
I've got a couple of thoughts about that.
Okay. You can talk about the data, talk about, and then.
So one very important factor that he left out of that statement is part of the reason why American healthcare costs are so high is because of medical malpractice. Doctors are held to a standard that is incredibly high, and the malpractice fees that they pay are incredibly high. So, for example, if you one of the discussions that was being had during the the lead up to this potential nomination was that there's a crisis in rural areas about absence of doctors. There's not enough doctors in rural areas. There's not enough hospitals in rural areas and things like that. Well, one of the reasons, and especially in obstetrics, one of the reasons why you have a very difficult time getting an obstetrician to go to a rural area is not only are they there often by themselves, so they're on call 24/7 in delivering babies at 3 o'clock in the morning and things like that, but they also have what you call a tail insurance policy for malpractice. And what it entails is if once you retire, there is a statute of limitations under which you can be sued for that is different for different practices. In OB, you can be sued, as far as I understand, for up to 21 years after delivering a baby. And you have to have malpractice insurance cover that for the whole time. Otherwise, you can lose everything, right? And this is because the statute of limitations for a lot of things is 2 to 3 years. But if a child decides that they had been somehow injured and then they discovered this injury a long time after they were born, they still have the right to sue for a very long time. These tail insurance fees are in the neighborhood of $74,000 a year, $75,000 a year, depending on how high risk your practice was. And so it's very hard to find people who are willing to put that on the line. If you delivered your last baby when you were 65, you're liable until you're in your 80s. so that's a big, huge problem. The other big, huge problem is that malpractice it's kind of a microcosm of how companies are what they face in terms of there is a lot of litigation that is directed towards companies, that's directed to doctors, directed towards businesses, that it's not founded on sound science. And because of that, it makes it very difficult for companies to defend themselves. And so I know a lot of people don't have a lot of love for companies, but pharmaceutical companies make really important drugs that treat very difficult conditions. And I'm not saying that they're perfect. I think that there are all sorts of things that they need to do to improve. But part of the reason why things are so expensive here is because of litigation. And I do agree. I do agree that Americans are largely financing the rest of the world's ability to get free healthcare, to get cheaper medications, to get all of that stuff. That's coming off the American worker. And I think that needs to be revisited. So I agree with that 100%. We need to make some big changes. But once again, I don't necessarily want the scientists who work at pharmaceutical companies. People look at big pharma and think big pharma is bad. But the scientists who work there, they all went through this epidemic together. They all have families. They were all under lockdown as well. And they created an amazing solution to that problem. And I'm not saying that it was absolutely perfect, but it's an amazing technology. And I hate to see that go by the wayside because of litigation.
Yeah, I mean, I think that the litigation piece is important, but I think that there's two separate issues here. I think that conflating the cost of healthcare with our incidence of disease and just unhealthy state as a country is part of what makes me, kind of concerned about what his approach is going to be. And so
Yeah,
I think while it's true that we have all of these chronic diseases, these are a problem. We are unhealthy as a nation. That does need to be tackled. It's also
absolutely.
true that we spend an obscene amount of money on
That's true too.
healthcare. The overhead, the administrative state of medicine is ridiculous. The middlemen in charge
That's
causing
true.
prices to rise in a lot of these pharmaceuticals that we're talking about as well
Yep.
are an issue. The government bureaucracy to create a vaccine, then approve that vaccine appropriately,
Yep.
are also an issue and a part of the cost in that, in there too. But I think I think he's trying to have too many conversations in one and conflating these ideas and making it seem that one is directly related to the other. That's my concern here. And so I think we can have that conversation. I think what he is doing, though, is articulating Americans' concerns.
I think he absolutely is. I think he
Yeah.
absolutely is. And I do think that there is an epidemic of chronic diseases. That's not unique to the United States, though. There's an epidemic of diabetes in India that's just incredible. And there's an epidemic of obesity in Europe as well. So to claim that it's just unique to the United States, I think is not true. What I do think is that we are living in a time where we have unprecedented abundance and the safest food supply in the history of mankind. If you look back at the beginning of the 1900s and read Upton St. Clair's book, The Jungle, and look at what was involved with food safety back then, it will blow your mind. People were getting botulism regularly. People were getting typhoid.
We were dying from infectious disease and foodborne illnesses. Much more. That was
exactly
that
right.
was the top of our
That's exactly
list
right.
of causes of death, right?
And now that we're not doing that, we've got chronic diseases, and I absolutely think that we should be doing preventative medicine and trying to get to the root of it. But it's not going to be food coloring that's making your kids sick. And so spending a whole bunch of taxpayer dollars on that, when we've spent taxpayer dollars already investigating food coloring to a great degree, is not going to be productive. I think we need to be looking at, what kinds of things, what kinds of solutions can we have to these problems? Exercise, less. I mean, I was actually at a restaurant the other day and I wanted a chicken sandwich and they gave me this enormous sandwich that had 2 patties on it. And so the food quantity that we have, that could address it. It decrease consumption of sugar. There's a whole variety of things that we can do. I happen to think that the GLP-1 agonists are fantastic. But I'm not promoting them one way or the other, but what I'm seeing, the data that I'm seeing from them are pretty interesting. That said, I think that so there is an epidemic, but we need to be very careful about where we put our resources. Are we putting them into things that we are wasting money on? Because we've got 50 years of data that show that this product is safe and it's not going to be contributing to a health problem. That's my take on that.
Yeah. Cameron, what do you think? Do you think about his ability to articulate Americans' concerns over health?
I don't want to be a dupe here, but I'm encouraged by some of the things he said during his confirmation hearing. So, for example, Senator Bernie Sanders was trying to grill him on whether or not healthcare is a right, and without missing a beat, he said, "Well, like free speech is a right? No, it's not a right that way." And then Bernie Sanders said, "Well, how can you say that?" And Kennedy said, "Well, if someone smokes for multiple decades and they develop lung cancer, they don't have a right to treatment, and I'll add, maybe we should do everything we can to increase access to that kind of healthcare." But I think the point that he's illustrating there is that people bear a lot of responsibility for their decisions.
Yeah.
So I don't know as a matter of
Yes.
policy that he can do that. There's been a lot of research on, let's put in more water fountains and let's make people walk more and let's tax soda and blah, blah, blah. None of it works. Everyone knows that. The data is very clear. But to the extent that he can initiate a conversation where people start thinking about, like what Liza was saying, like, if I go to a restaurant, do I really need a chicken sandwich the size of a house. Like you can make those kind of recommendations, I suppose, and you just get people thinking differently. Um, but my concern is, as a matter of policy, he's going to try to do things that are actually going to make it harder. So, for example, the FDA could totally revamp its regulation of low-risk nicotine products like e-cigarettes and nicotine pouches. These are significantly safer than combustible tobacco, and the FDA has done everything it can to effectively clear the market of most of these products, unless they're manufactured by giant tobacco companies, coincidentally. Um, so if he really cares about helping people make better decisions about smoking, for example, he could make these products, still ensuring that they are reviewed and that they are safe. He could make access to these much more widespread, and he can actually discourage smokers to switch to something that's much safer. So all that to say, I'm not sure what he's going to do yet. There's lots of speculation, but I don't think there's really much that we can go on that's concrete.
Yeah, I like that. And Jon, I see you chomping at the bit.
Yeah, yeah. I'll really just, I guess I'll sort of disagree with Cameron on emphasis. Well, actually, greatly disagree. And the point on Liza, I agree with everything she said, but I think she's not really talking to the issue that's here. Let's focus on Robert F. Kennedy Jr., who I think is the greatest threat to the American health system that the United States has ever faced. I mean, he is the classic example of the broken clock theory. 24 hours a day, two hours out of the 24, he says something that's right. 22 hours, he says something that's really ridiculous. And the only reason the two are right is because the clock happened to hit that hour at that point. His diet, you went through a list of things, and I want to go through some of those because every one of those is, he doesn't even understand what he's talking about. For instance, he says that, yeah, he makes the case, and Eliza referred to this, that fat and diabetes, all these things are going through the roof in the United States. At the point that Eliza made, he doesn't know the data, which is the United States is actually fairly good on issues like fat. They're all bad. Let's put it that way. They're all bad. But if you compare the United States to Australia, New Zealand, Denmark, France, Norway, Japan, we're in the lower end relative to those countries. I mean, New Zealand's cancer incidences rates due to lifestyle is almost triple what it is in the United States. And yet people like Kennedy romanticize that New Zealand is this wonderful country that follows the precautionary principle. He doesn't even know the basic facts. And I don't think there's an issue that he talks about in which he is reflective of the basic facts. He talks about cancer rising in young people. Well, first of all, cancer rates in the United States have been going down now for 29 straight years, particularly among young people. Are there some blips? The rises are from like 0.05% to 0.07%. So yeah, maybe that's a 40% rise, but it's a 40% rise from insignificant to insignificant. If you look at the overall cancer rates on things that really affect a large number of people, have never been in a better situation. Now, I'm not extolling the American health system. Problematic, lots of issues, distribution issues, fairness issues, waste issues, all those things, but that's not what he's focusing on. He doesn't have even a high school student's understanding of the complexity of the American health system. He doesn't understand science on the most basic levels. He doesn't understand mechanisms of disease. Is he raising the issue of reform, and that's important? Sure, but you don't want an idiot savant being the one to raise these issues. You want someone who actually understands what science is really about. And I can't think of one issue, and I'm happy to debate it, on which he's on the correct side of science. And that's very frightening to me.
Well, Jon, that's the thing though, too. And that's part of the discussion that we're having here today is what is America's perception and where is it coming from? Because you just had, Liza, me and Cameron both say that he's articulating what Americans are fearful of.
Oh, I agree. He's articulating
our diseases, right? Or think are real issues. And that's a problem. I mean, we have a few comments in our, Q&A right now. Chronic pain is an issue for Americans. Suicide is an epidemic.
But we are not anything more than all the countries that he extols. He loves Europe. He thinks He thinks it's the precautionary principle, which he doesn't even understand, and it's a little complex, so we'll only discuss it if you want, somehow puts Europe on a higher level of sophistication in dealing with science and health issues, when in fact, one, it's misapplied, two, it's not science-based, and two, the United States is not better on any of these issues than in Europe. So he's selling a false bill of goods because he buys into the worst, most dogmatic kinds of junk science. I know I sound like I'm being hyperbolic, but
No,
there's
you're
no
not.
words
No.
that I could use that can overstate what a crackpot he is. And I mean that honestly.
I think,
I would mostly agree with that, John. Just to clarify, I'm not implying that he is, some sort of saint and he's here to right our ship. But I think he is, like Trump is, he's sort of a middle finger to the system, right? He's a rejection of everything that came before.
But Trump gets it right. And if I know I'm no Trump fan, but Trump actually gets it right on a not insignificant number of things. I almost can't think of anything that he gets it right on. That's the difference in my mind. I don't know.
And
Well,
yeah, go ahead, Kim.
I'll just say this. I think he poses a serious threat, but I think the real problem is the establishment in science has done such an awful job, has so badly botched their their use of authority, and we haven't talked about it yet, but this epidemic of fraud, right? Like people in science have done such an awful job that you get someone like Trump in there and he goes, okay, where's the biggest bull I can let loose in this China shop? And it's Kennedy, right? So that's my biggest takeaway that I hope people walk away with here is, he's been unleashed on the system because the system is awful for its own reasons. And I think that's
Yeah,
what
they've
we
created him. And honestly, and I probably lean a little bit to the left of most of us here, but I never call myself a liberal. But almost all of these issues originated with the crazy left.
That's right.
So it's not like, I mean, he's a creation of Bernie Sanders. Really, 5 years ago, you couldn't find a a paper sheet of difference between their views on most issues. It was only more recently with his alliance on rejection of mainstream vaccines that has become so prominent and identified with him that there's been a break on that. But almost every other issue, the big ag, big pharma,
right,
all these myths that undermine a rational, structured, complex, discussion of really important issues. I mean, he was on the side of idiocy, on the left idiocy on all those issues for a long, long time.
Yeah, he even said so in the confirmation hearings. He's even said so in that, he said, last year, this time, you guys were on my side. So he acknowledges that.
Yeah. So what is interesting? So here though, like even if he's wrong about these specific issues, and there's I've gotten several comments in the chat about their different people giving their take on what they believe are primary U.S. health issues. Chronic pain, we just talked about, suicide, smoking, all of these things are things that people think are issues that absolutely need to be addressed by the U.S. And those are issues that need to be addressed by the U.S. But if you're you're putting a person in a position to oversee where we spend the money on health issues. Even if he gets it wrong right now, do you think he's, and the other people that have been selected by this administration will have an approach to truly look into and find what those things are, to lead quality research, and then take a public health approach that is actually going to be different than what we've seen in the past here?
I don't think so. And I think he's saying lots of things that sound very appealing, but I think let's just take the chronic pain issue, for example.
Okay.
What is amazing to me, so I'm a toxicologist. I watched the whole opioid epidemic take off during my career. So all the way back in 2003, I saw the opioid epidemic start, and it started with heroin. It didn't start with, yes, there were some people who took pills, but and that's a component of it. So I'm not going to deny that 100%, but it really started with heroin. And heroin took off really took off after my fellowship. In 2006, 2007, you saw this huge spike in people that weren't using heroin normally. And most of them did not start with pills, right? The problem is you can't sue cartels. You can sue companies. And so I'm going to say something that a lot of people are going to disagree with me on, but Purdue became the focus of this epidemic when it actually started really, I believe, fundamentally because doctors don't report heroin overdoses to poison centers, but they do report opioid pill overdoses to poison centers because there's often a Tylenol component to it. So the data were skewed a lot in this reporting. And so let's just sort of go follow to the natural kind of end. Physicians did, and medical schools and the public health arena did what we could to limit opioid prescriptions, because the claim was that opioid prescriptions were what was causing the problem. And who did that affect? That really affected chronic pain patients. And so I'll never forget getting called into the ICU to see a woman who had metastatic breast cancer to her spine, was paralyzed from the waist down, had probably, weeks in terms of survival. I was called in to give an addiction consult to this lady because she had inadvertently overdosed on her pain medicine because she was in so much pain. And I keep on hearing about pain patients who are not getting medication to the point where they're suicidal. And then the patients who are, using illicit fentanyl, they're not getting the fentanyl from the anesthesiologist. They're getting the fentanyl from the street, right? And the fentanyl is coming, illegally. I'm hearing those guys get all sorts of empathy from the addiction medicine community. And I know both these communities, these doctors, pain medicine people and the addiction medicine people, very, very well, because it's the intersection of that is in my specialty. And I feel like we've been doing needle exchanges. We've been doing all sorts of things to reduce harm in the community that is addicted. But the pain patients, the true pain patients, we've been so fearful of ostracizing, of getting them addicted, that we're not treating their pain adequately. And that's resulting in an explosion of suicide in that community. And then with our harm reduction methods, what do we have to show for it for the past 20 years? We've got this incredible explosion of addiction to opioids and opioid related deaths that really spiked during COVID. And so I think that we need to reevaluate that setup. And how we've managed it, and I think that that's also led to a whole lot of distrust in people. That here we are catering to a group of people in one way, and it's not decreasing death, it's not decreasing suicide. It's led to a worsening of this particular epidemic, and we are really, I think, causing harm to the pain community.
Thank you for that. Yeah, that's a hot button issue in the chat right now too. And I think that warrants some additional discussions. That maybe even in a separate webinar. I was gonna ask my next question, but I think our Q&A's been pretty lively here. I think another piece of this is Christopher Grallert asks, do you think Kennedy understands that litigation and heavy administration in hospitals adds significantly to healthcare costs as outlined so well here?
I'm sorry, I'm not exactly sure. Maybe you can interpret what you think he's asking, because
do you think that Kennedy understands that litigation, which Liza did mention, of course, but also the heavy administrative burden in hospitals adds significantly to healthcare costs.
I
Do
would
you
speak.
think that he understands that? We've talked about this, but do you think that he understands that?
I think those are two different, not even slightly, I think they're quite different issues. In terms of litigation, I don't think people know this, but Robert F. Kennedy is a classic ambulance chasing tort lawyer. He's made his career going after corporations, mostly making safe products, things like Prozac, and yet extracting billions of dollars, literally, of settlements from companies who are making drugs that are considered safe. He's part of the whole anti-talc thing, and we know that talc hasn't included a cancer-causing agent since the 1970s. He's gone after. He was the co-partner with through a law firm called Baum Hedlund, which is based in California and is the Church of Scientology law firm. He co-partnered with them in the first three cases on glyphosate, extracting billions of dollars in settlement money and leading to litigation settlements with Monsanto/Bayer, when the global health community believes that glyphosate is not harmful, but he used the extortion tactics, which are very, very common among the tort industry. I mean, he is part of the problem. He is exactly the reason we have high drug costs, not the only reason, but one of the key reasons. And the tort industry has aligned itself with the most radical leftists, groups like the Environmental Working Group or Pesticide Action Network, which demonize chemicals rather than making discriminating understanding between chemicals that, when misused, can be harmful, or when they are used appropriately, are essential, because everything is a cost-benefit analysis. So I don't know about the other part of the question, but in terms of litigation, I mean, that issue alone should disqualify him, because he literally is, and I'm you've already known I have a penchant for colorful language, but he's a litigating whore on these issues. He goes after companies to extort money from them on products that are safe. And I'm not saying he doesn't believe in his causes, he does, but he's not on the side of science on things like talc, glyphosate, aspartame. He believes that aspartame used in things like Diet Coke causes cancer, when Europe and the United States has determined that to get cancer from aspartame and Diet Coke, you literally have to drink 35 cans of Diet Coke every day for 40 years. And even then, your chances of getting cancer are minuscule. But he wins cases like that because under the American judicial system, which rewards tort lawyers, companies will settle even when science is on their side, because they can't afford risking literally the very survival of their companies, because a rogue trial system will end up putting them out of business, in the way that we put the talc industry out of business and have put glyphosate in the crosshairs of litigators.
And I'll add to that.
What's the answer to that, though? So what's the answer to that? How do we get the message of, like, the real science and the real data that, or the truth message out there, when we have such powerful litigation? And Jon, you and I are going to do a separate webinar on the tort law on next week, next Wednesday. Tune in, we'll talk about that.
Liza,
but what is the what is the answer? Because we're talking about public perception.
I think there
needs to be, and the media's role in this as well, politicians' role in this as well. They're in our public health. So are there going to be people, picked in this administration, or are there other people out there that you see who would be better voices at this, would better articulate the alternative view and bring this discussion to the top of people's minds, number one, and then two, to really, really have a genuine debate about it.
One quick interjection.
He's pledged to bring back gold standard science, right?
So
if that's what he's doing, then he wants to hear the real truth and the real science. That's my assumption. I can only believe that he truly means that means that when he says that.
I do believe he means that. I just think he's not very smart, is what he is not very smart. But on the issue of tort reform, I think that's what we need in our country. Canada, which is most everyone would agree is more liberal than the United States on almost all these issues, actually has a rational tort system. And this is something, here my Republicanism will come out. Republicans have been pushing for tort reform for ages. And the Democrats, and again, you know that I'm sort of lean liberal on some things. The Democrats have been using the tort industry as a cash pile, literally. They get more money from the tort industry, buying them off, because the Democratic Party and the Democratic views on these things is that industry is always in the wrong. And therefore, no matter how much a corporation pays for a claim, it's worth it because it's big ag or it's big pharma or it's big one thing or another, really cliches. And the Republicans have been saying, no, we got to get this under control. Some saying, oh, it's the Republicans just defending corporations. And you can make an argument. In some cases, it may be that. But the reality of it is the most liberal countries in the world don't have the train wreck of a tort system that the United States has. This is an issue that hurts all of us, left and right. The fact Republicans have been cheering for this, the U.S. Chamber of Commerce, who, again, I may not be supportive on lots of things, but they're absolutely correct on this thing. The problem is Kennedy supports the very thing that has created this train wreck. He doesn't want tort reform. He really would like nothing better than to bring Bayer and Lilly and all these companies to their knees. And if we have that, the United States is still the center of research on science and health in the world, hands down. And he will cripple that system. Or do we need reforms because of corporate excess? Absolutely. But the biggest thing we need is tort reform. So there's a fair compensation for people who are aggrieved in certain health situations, but it's not the money pot where someone, gets burns himself with coffee and gets a $300,000 settlement from McDonald's. That's the system that we have, and it's very corrupting.
If you look at, like John, just to reiterate what John was saying, if you look at other countries around the world, you're not seeing the same kind of litigation because you have to have a scientific basis for your claim.
Tell me about Australia. Tell me about Australia and glyphosate. What happened?
Yeah, so they tried to bring in class action lawsuit in Australia recently around glyphosate, claiming that it was associated with non-Hodgkin's lymphoma, and it got closed down because it's not. And you have to have a scientific basis for the claim, and the science is just not there. Same thing with baby powder. J&J lost a $4.7 billion lawsuit here in St. Louis a couple of years ago on a completely science-free claim. This is an American company that employs, thousands of people. We can't have American companies being completely taken apart if you want to have employment, if you want to have, good products that really help people. And tort is actually what this whole tort thing is actually what led to this opioid discussion, right? A lot of the narrative around the opioid epidemic comes from the tort industry. And a lot of pain patients can't get access to medicine that they need because of tort. And so I think that if you are harmed, then you should have the ability to sue. But there has to be a scientific basis for that claim, and there has to be a balance, because if we bankrupt all of these companies, you don't have capitalism anymore. And so,
okay, but what about the people who say or believe that our science isn't transparent? So one of the things that Bobby Kennedy did articulate when he was asked about what he meant, science should return to, what's gold standard, is to publish raw data. And there are parts of our process and the way that we approve drugs and approve vaccines where we're not really required to publish all of the data in a transparent way. And so that is a legitimate concern. That's a concern that I have, particularly around the COVID pandemic, when the mRNA vaccines for COVID were coming out, is that we did not have access to this data. And we were being told things about the capabilities of the vaccine that weren't true, and only to find that stuff out later. So Yes, I think this conversation is important, about tort and the requirements for bringing a lawsuit and taking down a company is important. But what people are concerned about, at least people that I talk to and are worried about the inability to make the assessment for themselves, and the ability or the lack of the government's willingness to be transparent around these issues, and then the media being complicit with this, science, and the science industry. So Cameron, I actually want to hear from you because you've been nodding a lot, and I want I want to get your take on this.
You brought up the media, and I just started to get giddy in my chair. So
Yeah.
here's the problem. Um, a significant number of media outlets are funded by interest groups that have a stake in the outcome of these issues. And I'm not just talking about USAID. I'm talking about major foundations that have a clear political bend, and they go to major outlets like the Associated Press, Politico, of course, CNN, and they pay Pulitzer. They pay for coverage of their issues. You can see the same thing in entertainment. So in Netflix, for example, my first foray into the opioid issue was a scathing review of Painkiller, the show on Netflix, because they all tell this sort of fairy tale that, we lived in paradise, and then right around the late 90s, this evil company called Purdue just started shoving heroin down people's throats, and then everyone's a drug addict, right? That is the gist of the story that the public is led to believe. And that is being told by major media corporations over and over and over. And it's happened with vaccines. It's happened with all the issues we care about. So someone in the audience, go to PubMed.gov, type in food dye, or type in pesticide, or type in microplastic. You will find a litany of garbage studies all promoting the talking points that Kennedy went in front of Congress and was saying. He quoted a study from JAMA. It's one of the biggest medical journals in the world. It's the Journal of the American Medical Association. They published a study correlating fluoride exposure with lower IQ in children. It's JAMA. So what I'm getting at here is you have, as we've talked about, the major scientific institutions publishing or funding and publishing junk science with obscure data or bad data when we have access to it. You have the media amplifying this. And then the trial lawyers come along like Kennedy, and they start acting on this. And then we all go, well, gee whiz, why are we bankrupting our companies with bad science? Because we're paying for it. That's why.
Yeah.
The Lancet published the anti-vaccine paper that really launched the controversy. David Ropick, who's a risk perception expert, came in years ago. He was at Harvard at the time. And he said the media amplified the vaccine controversy. They would take a credible expert like Dr. Paul Offit, and they would set him against, some fringe doctor in the anti-vaccine movement, and they would treat this like it was a legitimate debate. So if you're just an average person reading the news, your perception of vaccines is that there's this real fight going on. And then Kennedy and people like him have acted on this. So I think that's an indirect solution. And I'll stop there. I'm sorry. I'm getting more.
Yeah, well, and when you mentioned Paul Offit, who's been a very much a pro-vaccine person, he also had a lot of questions about mandating the COVID vaccines in children. And that was actually not really promoted by
and he got backlash for it.
These same journals, right? And he got backlash for it.
So
that's another piece of this. It is our scientific structures in our bodies that are actually leading these discussions too on both sides. This is just like Jon mentioned in the very beginning, that this is a problem with ideology. We're promoting junk science on both sides of the aisle. Where are the people who are in between, who are looking at the real data and getting their voice, the good data, or doing good research and then getting their voices heard? Where are they, and how is that going to happen? And I want to get back to the kind of the topic at hand here. Is there are people in this administration who were nominated. I am particularly excited about Jay Bhattacharya and Marty McCary, who both take a very nuanced, apolitical approach to this. And that, to me, is that going to be enough, though? Or is that what we need to have a balanced approach to a Kennedy as Secretary of Health and Human Services?
Yeah, I think, go ahead, John.
No, go. You go, Liza.
I think a couple things. Just really quickly touching on transparency. I think you're absolutely right. To bring back trust in science, there has to be transparency. And our company has actually got our data publicly available. And so that across the board for people can go to a transparency website and look. And we're the first company to have done that. And I think that that's an important solution for the problem, so people can decide what they think. I think then you will have more middle ground people like Marty Makary and Jay Bhattacharya. I think Marty and Jay have gotten a huge amount of backlash too, and I think what that's shown, there are always disagreements in medicine because medicine's nuanced, and being an emergency physician, looking at a patient and talking to a consultant on the phone, you often have disagreements, right? The COVID put that in relief again, because you saw doctors from great institutions having disagreements with each other publicly. And I don't think the public had ever seen that before. And that's reality. People have disagreements. And I think it's important, if you've got people who have solid scientific backgrounds that have disagreements, that you're not squelching one of those sides, right? And I think that they got caught in the crosshairs of political stuff, and I hope that they can contribute. And Paul Offit did too. He got a lot of backlash for going, yeah, I don't know about that many boosters, or yeah, I don't know about this many things in kids. But he was telling the truth, and he was. The thing about COVID, especially, is that we were all in it together. We were learning in real time, and the retrospectoscope is 2020, but I do think that it's important to hear nuanced views, and I hope that those two can, add to the conversation in a way that will rebuild trust.
I want to jump in on that Jay Bhattacharya, which is a really interesting issue subject person here, because I have mixed views about him, probably a little different than some others. I'll say what I think he got right and what I think he got wrong, and why understanding both is important to understand, because he could do great things if the smart side of his perspective really comes to fruition. I think what he introduced into the debate very early on, which smart scientists knew but were afraid to talk about, was something what we call age stratified risk, which is the risk of someone who's 10 years old getting COVID and getting sick from it and getting a health danger is far different than someone who's 70 years old. That was known from the very beginning, but was kind of suppressed because there was an ideological decision by the Democrats to not have this kind of nuance for fear that there'd be backlash against it and undermine their own policy. So I understand some actually were not sophisticated enough to even make this argument. Some actually believe the horseshit that age stratified differences were not real, but I think some of them made a political decision. So that was a nuance that he has and still has, that took years to be appreciated. And by not appreciating that, we have the devastation that was caused by closing down so many schools and really damaging the education of children in the United States for years, because some schools were closed down as long as 2 years while other places opened up. The not so smart part of it was he didn't understand, as many people didn't understand, long COVID. He really did not grasp that. And so some of his comments in retrospect did not even appreciate long COVID, even among young people. And I think maybe he would do it differently. It never came out.
I think it's very difficult to appreciate long COVID when a lot of it is survey-based data.
I know. So I'm not saying it's right or wrong. We know that
there's not a lot of good science around it.
Listen, I agree with you. All I know is it's an issue, and all I know, I'm just raising the fact that this is, like everything, a little bit complex. Do I overall think his viewpoint was more nuanced than most? Absolutely. Yeah. And that was not a time when nuance was considered a big issue. So look, am I hopeful that we'll have that kind of ability to discuss it? what he represents is clearly a well-educated person who is not an idiot. He didn't roll out of the crib and suddenly spout these crazy ideas, and he was not given the respect to have these issues as part of the public discourse. That's a disgrace that would happen because we had censorship and a suppression of social media and all kinds of things. So
yeah, and he was one of the people who was censored.
yeah, no, I totally agree. No, I'm arguing for him in that sense.
Yeah, no, I know you are. I know you are. I'm just bringing that point
All
up.
I'm saying is that no one, there was so much, and this is what Liza said, so much we were learning in real time. And some of the mistakes that were made and the excesses that were made by people who, didn't know in March, April, May of 2020 whether we had a Black Plague upon us and a third of the world would die. We didn't know. By later that summer, we kind of were beginning to have a handle on. I actually did an article for Colette, believe it or not, as I mentioned earlier, on why Africa, which was supposed to be the world hotspot in COVID, ended up being the world cold spot in COVID. Mm-hmm. And it's because we denied basic information about science and genetic differences for politically correct reasons. Now it's truly recognized that there are two major factors. One, the relative youth of Africa. A lot of them probably got COVID, but it was asymptomatic and also it wasn't passed on particularly in a virulent way. And the other is because the genetics of different populations are different. Different populations, because of the accident of evolution, some are affected by certain diseases and some are not. Why did two-thirds of Europe not die from the Black Plague? Because of genetic mutations that we now understood existed then, though we had no way to understand specifically what they are. So all this is about, I think we can all be backseat drivers and be expert in this stuff.
I'd also like to
have thoughtful voices like him in there that are stirring the pot, I think, in a constructive way, not in a destructive way.
Yeah, and I think honestly, I think that will be a big balance. I mean, the Secretary of HHS really is pretty much the funding arm of all of this stuff. So the people who are really going to be driving the policies are going to be the people who are controlling these other agencies, and NIH is a big one. So if our scientific journals are putting out good science, and we have somebody leading that, I think to me that gives me a lot more hope. If our FDA is taking a really critical look at drugs and vaccines before putting them on the market or taking them off the market, I think Marty McCary is a great person to be there. Where we're spending and funding that's the control of HHS. So I think that even if he's got some ideas that people think are bad ideas or not quite right, I do think that the people controlling the real policy arms and things are going to be a beneficial offset to him. We have a ton of questions. We have 18 open questions in our Q&A, and we have less than 15 minutes left. So I want to try to get through some of these sort of in a rapid fire way. I think we've addressed some of them in a roundabout, and some of these are just comments, but I don't want to leave anybody out completely. I also want you to know that look at the chat for links to email addresses and ways that we can and ways that you can contact our panelists. If you do end up having some questions that we don't get to today, you will be able to email us as well, and then we can see if the panelists are willing to. The panelists will be willing to answer those specifically if you want to direct them at each of the panelists. So. We didn't talk about Janet Nishwat as a Surgeon General nominee, and the question on her whether or not she would be putting the brakes on RFK Jr. I'm going to answer that, and I'm going to say she's completely to the opposite way of a lot of what conservatives think how policy should have been directed at on COVID. So I think that I don't know how much power the Surgeon General has. To me, it seems like it's more of a public-facing version of. They don't really have a lot of power in terms of controlling the purse strings and where things are funded, or but maybe you guys know something a little bit more than me about that. Okay, so let's see. Cam, there's some thank yous in there for you. The media pushes the narrative that pain meds are bad. And also there was a similar one directed at you for that, Dr. Liza too. So answering and addressing those questions, I think are complimentary. Let's see, here's a really good one. Gosh, where did it go? It was on the germ theory. Oh, here's one from an anonymous attendee. In the USA, really at the is the USA really at the low end of other developed countries in Europe and Australia and New Zealand? This is the data I found and the sources on obesity rates comparing adults. United States, 42% of adults are obese. This is 2020 data from the CDC. Australia, 30%, according to their Institute of Health and Welfare. New Zealand, 34%. Germany, 25%. France, 17%. Italy and Spain, 10 to 20%. The Nordic countries, 15 to 20%. The US has the highest obesity rate among these countries, followed by New Zealand and Australia, with Southern and Northern European countries tend to have lower rates. Partly I'm going to answer this question because I believe that there are a lot more factors contributing to obesity than just how much we spend on healthcare and what's in our foods that are not ever really considered in this discussion. And blaming it just on the foods and food processing and whatever else is not the full answer here. So we also have to look at how their population, how their healthcare is structured in these countries, which tend to have smaller populations than the United States and less fragmented type of healthcare system. There's also lifestyle issues that kind of go along with this as well that we just don't discuss. And lifestyle means a lot of things. So either of you have thoughts on this, particularly about the stats, because we did, I don't remember who said it in the beginning that these particular stats were wrong. So this definitely refutes saying that the United States isn't.
Well, I think it's a much lower percentage of obesity than Kennedy said. I think he said
correct.
Something 70%, which is so. I think basically, I think we can argue stats. I think obesity is a problem. And I think it's a problem in the United States, but I also think it's a problem in other places in the West. And it is a lifestyle problem because we are more sedentary and we consume more than and sugar and fat and all sorts of stuff. We need to address those problems. We absolutely need to address those problems. The way not to address them is to go back to a form of agriculture that we've had for 10,000 years of experience with, and that doesn't reliably feed people. The way to address those problems is to look at what can we do to motivate people to eat less, exercise more. In Europe, you tend to have a lower obesity rate because you've got people walking everywhere. And that's the way the cities are designed. You aren't going to be able to walk from one side of Houston to the other, but you're able to walk from one side of Bruges to the other, right? So it's a function of that. So I think that we need to be, kind of circumspect about these stats. One of the other things is that we have an aging population, and you get diseases of aging, right? So you get cardiovascular disease as you get older. We're mortal. You get cancers as you get older. You get, a variety of different things. And so you don't want to, the 20th century was the most incredible century in the history of mankind. In 1900, 45% of our population farmed. They tended to be subsistence farmers, and we lived to the ripe old age of 45. By 2000, 100 years later, despite 2 world wars and famines that killed over 100 million people, we added a 35-year increase in life expectancy. And that's because of 5 public health advances of the 20th century. And these 2 have heard me say this over and over again, so they're probably just like, oh my gosh. But anyway, the 5 public health advances were water sanitation, antibiotics, vaccination, food security, and vector control. We were able to manage the things that caused infectious disease. And that's what helped our children live past the ripe old age of 5. So all of those, except for food security, were related to managing infectious diseases, which killed huge numbers of people in the past. Going back to organic farming and drinking raw water and stopping pasteurization of products will reintroduce those infectious diseases. And so I think it's really important to be very sort of careful about the remedies that we are prescribing for our current epidemic of chronic disease. So I think that we should definitely try to get to the root of those things, but it's not by going back to practices in the past that we have not had direct experience with, because we've been the beneficiaries of incredible scientific advances.
Yeah, well, and I think there's also a nuanced approach to this as well, because there are some things that maybe we could stop doing if we did more of something else, like if there are more small farms or people were actually growing their own vegetables and their own produce and controlling infection that way. There's so many things that we know about sanitation that they didn't know back then that contributed to infectious disease and death. People who, you have your own cow or your own chickens and you're getting you're controlling their health and they're not getting bird flu, or the cows aren't, getting sick or injected with hormones that you think are, going to be harmful to you, then it's easier for you to kind of control the sanitation, there, or your risk, to getting, certain diseases. So there are things that we can do sort of as a mixture of things, but in terms of feeding the world and feeding, which it seems that we're doing that with all the revelations from Doge, or in feeding large populations and eliminating hunger, that we do have to consider a multi-step approach to controlling infection and controlling illness here. There's one more question I'm going to ask. It's going to
make one quick point, Nikki, on the issue of obesity. I think it's really difficult to say, let's compare the United States to, to Norway, to Australia, to Germany, whatever, because the United States is demographically and in terms of the wide breadth of income levels is different than almost every one of those other countries. When you look at education levels, for instance, the United States levels of educated people are no more obese than in any other country. I mean, it's about 25% for the highly educated that are obese, which is actually a little bit lower than the same demographic in places like England or Germany or others. So the really issue is that the poor in our country and the least well-educated in our country are the ones who are the victims of this. So it's not just the United States and our broken food system. The problem is so much broader than that. It's a structural issue in terms of society, income levels, discrimination. And, I don't want to dismiss this in a base of issues, but the fact is that just saying the United States is worse doesn't yield you any answers. You got to really drill through the data and seeing where the issues and challenges are.
Yeah. All right, I'm going to ask this one last question and then we'll do our closing. And this is going to be a loaded one, so will do kind of a rapid round answer to this. So Sandy Slezak writes, yes, there's an epidemic of chronic diseases. Unfortunately, it will take decades on our money and decades and money on R&D to help eliminate chronic diseases. I suffer from a disease that I've had for 40 years. There's little research and clinical trials into the disease I have. Unfortunately, my disease has resulted in chronic pain. Full disclosure, I have psoriatic arthritis, and it's a chronic disease, and I have chronic pain from that too. So Sandy, I can sympathize with you there. The government is now in the exam room with the doctor and patient. This is the point that I want to bring up. The CDC put out guidelines in 2016 to help physicians with treatment plans in regard to pain medicines. So the loaded question here is our government, where do we draw the line of what our government should be doing to help guide our policies and how doctors are treating diseases like chronic pain, obesity? And then is this administration going to help or harm those chances? So just kind of the quick rapid fire, less than 1 minute answer for me, if you can.
I think
we'll start with Cameron.
Sorry to interrupt. The less they do, the better. Like on the chronic pain issue, the CDC has been a disaster. If you want to learn more about this, my colleague, Dr. Josh Bloom at the American Council on Science and Health is the expert on this. Go read what he says. It's
Josh
just been,
Josh was actually in the chat too today. Thank you. Hello,
yeah,
Josh.
yeah. What's up, buddy? You're my hero. Go read Josh's work on this. It's very good. The CDC guidelines, they don't have the force of law, but what happened is they put them out, and then you had states around the country start to enforce this. And so this is the tragedy here. So to answer your question, the less the government does, the better, because physicians know how to treat their patients. We've got two on the panel, right? I don't think you guys need oversight from some bureaucrat in Silver Springs to, make sure that you're doing right by your patients. I think you have the training and you care enough to do that on your own. So less is more, I think.
With good data, though. We need good data.
Yeah.
Good science, right? All right.
I would
Go ahead, Liza.
agree. I would agree with Kim. I think that with every intervention that the government has had into the patient-doctor relationship, patients have suffered. I think it's decreased the quality of medicine. Medicine that is protocolized does not take into account the nuances of your individual patient who are sitting in front of you. Every quality metric, the introduction of the HITECH Act with the electronic medical records, all of that has taken away from the fundamental doctor-patient relationship. And I think that we need to be guided by good data. So you can't have bad data coming out of the Lancet, right? But I think that it's important to restore that. All
right, awesome. And Jon.
Well, I'll go almost counter to everything that you think I've said the entire time, which is to say, I lean towards creating short-term chaos. And with all the problems that I think this administration is causing, they also provide opportunities. And I think the US system is more resilient than people are giving it credit for. I think we do have checks and balances. I absolutely think the administration is going to go off the rails on lots of issues, and probably Kennedy more than on others. But I also think it's putting issues in the public forum to discuss that had been basically something that we couldn't discuss before. We really are in a different situation. And I appreciate the fact that we are now going to have vigorous debates on things that had been sacrosanct before. And that can't be a bad thing. And I have great faith in our political system that will restrain the excesses. And in the end, maybe veering off in some desperate directions here and there, it'll be for the better overall.
I love that. And that's exactly where I fit, Jon. I mean, I totally agree with that. I'm 100% in that corner and thinking about, we're talking about it now. That is a big part of this problem, that we've ignored a lot of this stuff, and we're talking about it at a national level. And so that's a big part of rebuilding this system. So I want to thank you all for joining me today and giving me your time. I have had a fantastic time. We had a lot of enthusiastic audience participants, and just a really, really fantastic discussion around this. So thank you so much for joining me. If any of you are in the audience, like what you see here, and want to continue supporting my work, our work that we do at Fair for All, we are entirely run on donations. We're a nonprofit organization, so we depend on people like you to continue to attend, share our work, but also to support us financially. So we will continue doing more webinars like this. We hope that you'll consider supporting FAIR with a donation today. To find out more about our work, go to fairforall.org, or directly to donate, fairforall.org/donate. The links will also be to connect with our panelists and to communicate with us at FAIR will be included in our chat, but also they will be in the show notes that will take you directly to all of these places. Thank you all for joining us today. Have a fantastic day.
Thank you very much. We're excited.